The benefits of peer review. Welcome to the History and Physical Examination oral case presentation sessions, an integral part of your clinical education. As you embark on this journey to develop your clinical skills, we would like to introduce you to the concept of peer review, an essential component of the learning process. This handout aims to provide you with a clear understanding of the peer review process and its significance in your growth as a future physician assistant. The purpose of peer review. The primary purpose of peer review is to foster a supportive learning environment that promotes continuous improvement in clinical skills. By engaging in peer review, you will have the opportunity to, number one, learn from one another. Peer review allows you to learn from your fellow students by observing their performances and gaining insights from their approaches. Number two, identify areas for improvement. Feedback from multiple perspectives helps in identifying blind spots and areas that require further attention, enabling you to refine your clinical skills. Number three, enhance clinical competence. Constructive feedback received through peer review facilitates your professional growth, leading to enhanced clinical competence. Peer review process. Preparing for peer review. To make the most of the peer review process, it is essential to be prepared. So here's what you need to know. Number one, format of the session. During the history and physical examination sessions, one student will perform the examination on a standardized patient, while the other students will observe carefully and take notes. Number two, active observation. Actively observe and note down both positive aspects and areas for improvement during the examination. Pay attention to the details to provide valuable feedback. Number three, professionalism and respect. Maintain professionalism and respect throughout the peer review process, focusing on performance rather than personal characteristics. Conducting peer review. It is crucial to provide constructive feedback effectively during the peer review process. Follow these guidelines. Number one, structured feedback framework. Start by highlighting the positive aspects and strengths observed during the examination. Then, identify specific areas where improvement is needed and provide constructive suggestions. Number two, respectful communication. Maintain respectful and tactful communication while delivering feedback. Be mindful of your tone and choice of words to ensure a supportive learning environment. Number three, specific examples. Provide specific examples to illustrate your feedback and make it relevant. Specificity helps the student receiving feedback better understand the areas for improvement. Number four, focus on performance. Remember that feedback should focus on performance, not personal characteristics. Stay constructive and professional in your approach. Receiving feedback. When receiving feedback from your peers, consider the following. Number one, actively listen and be receptive. Embrace a growth mindset and actively listen to feedback. Be open to suggestions and view feedback as an opportunity for improvement. Number two, seek clarification. Feel free to ask questions if you need further clarification or elaboration on feedback received. Understanding feedback fully is essential for your growth. Number three, express gratitude. Express your gratitude for the feedback provided. Recognize that your peers have taken the time and effort to support your development as a future physician. Benefits of peer review. Benefits of peer review. Engaging in the peer review process offers several benefits for your professional growth. Number one, enhanced self-awareness and self-reflection. Number two, identification of areas for improvement that may have been overlooked. Number three, exposure to different clinical approaches and perspectives. Number four, fostering a collaborative and supportive learning environment. By actively participating in the peer review process, you can learn from your peers, refine your clinical skills, and continuously improve your practice. Peer review is a valuable tool for self-reflection, professional development, and ultimately delivering optimal patient care. Embrace this opportunity to grow together and support one another in becoming skilled and compassionate physician assistants.